Hello, all, and thank you for tuning in to The You in Youth by Sohail Daulat. The You in Youth is a new podcast funded by the National Reach Coalition and hope to raise awareness of the stories of the youth between the ages of 18 to 25. The National Reach Coalition aims to help underserved racial and ethnic communities achieve health equity, and we hope to use this podcast as a way to build resiliency through unity among the youth by sharing the impact COVID-19 had on us. If you are interested in being interviewed on this podcast, please reach out to me at sdaulat@email.arizona.edu. That's spelled SDAULAT at email.arizona.edu. In today's episode, we will be talking with Nadia Clark, a University of Arizona student and someone who aspires to become a doctor. And we'll discuss how COVID-19 and the pandemic has affected her. So welcome, Nadia. Can you tell me a little bit more about yourself and have been doing for the past year?
Yeah, of course, Sohail. I'm studying physio and my minors are in public health and biochemistry. I plan to pursue a career in the healthcare field one day. And just in general, I'm doing great. I'm having a great time hanging out with you today.
Oh, awesome. Yeah, I'm really glad you could make it, and I can't wait to see your perspective on how COVID affected you. So can you tell me a little bit more about how COVID has played a role in your life the past year or two, especially as a future medical professional, and how has it affected you as a student?
Well, on a wide level, I guess, a large scale level, it's affected our education. I transferred into the University of Arizona quite recently from community college, and that transfer really affected me just because I was entering an entirely new system and I wasn't sure how that would work out. Obviously, going from community college to a 4-year university, that's very different. And there are a lot of anxieties there when it comes to what kind of professors you'll be working with and the classroom, and add COVID and a pandemic on top of that. It was a little nerve-wracking. In general, I think we managed pretty well and the transition went fairly smoothly. But as a pre-health professional, I would say it did limit a lot of things, but I also think it opened up a great deal of opportunities. Limitations wise, we weren't allowed to go in person. A lot of hospitals were shut down, rightfully so. So we weren't allowed to do shadowing experiences, and things were just a little on edge between, I guess, pre-health professionals and the community, because there is that fear of transmission there. The opportunities that it opened, I would say, is we really, I guess, looked into the idea of telemedicine. That's been explored a lot more. There's been shadowing opportunities online. I think there's always a way to circumvent these difficulties that we face. I think the University of Arizona and just the Tucson community has provided a great deal of opportunities for us to access.
Yeah, no, that's really interesting. And I think you bring up a really good point, because a lot of people feel that COVID-19 has really limited the opportunities, but you changed it around a little bit, where you said that COVID-19 actually, limited some opportunities, but also rose new opportunities. So can you talk a little bit more about that and how you see the youth's role in COVID-19 and how basically the opportunities that it opened up for the youth and how the youth could have been more active in the community?
Yeah, I think with COVID-19, it really opened up the idea of what it meant to provide for one another and be there for each other as a community, because it really did bring a lot of setbacks and difficulties, whether it be financials, educational, mental health. And I think as pre-health professionals, if you want to enter the workforce, it's really necessary to look at things in a holistic sense. So you need to understand all the varying aspects, such as mental health and financial disparities and wealth gaps. So I think COVID really allowed us to understand those things on a much more deeper level. We were able to, a great deal number of people were able to start things like nonprofits and funds for families who may have experienced job loss, deaths. And I think COVID-19 really showed us what it meant to come together as a community. In my own personal experience, while a lot of things did shut down for a little bit, I was volunteering at Banner for a little bit, the hospital and other centers in Tucson, Arizona, there was a great deal of transition too. I work with children and discussing just grief and loss, and that was able to transition onto a Zoom centric base. So we were still able to meet and discuss coping mechanisms and things along those lines. So I think the important thing was just finding ways to circumvent. I think that was like something that we all really took from that, and like the importance of flexibility, and how we can apply these new measures into our day-to-day life continuing forward. But I think in essence, it's just kind of rolling with the punches was what I would say we could take from this.
Wow, yeah, no, that's really interesting. And so then makes me wonder, you said you worked with at the hospital, and you worked at clinics, and you worked with the youth, and probably a bunch of other populations. So what do you think, aside from your personal experience, what was the major thing that you saw with a bunch of the patients and how COVID affected them, especially the youth? How do you feel COVID affected the youth the most between the ages of 18 to 25?
Yeah, I mean, 18 and 25, those are the years that you find yourself socializing the most. You know, you're going out to meet new people, you're maybe entering new experience, like going to college, leaving high school, and to experience such an impact where it just completely limits or cuts off you from your surrounding community and social life. That is very difficult. And I did see a lot of hardships in regards to mental health.
No, I completely agree that it really did affect the mental health of so many people. And I think that's a really concerning aspect. And especially you said that you transferred from a community college into the university. Did you transfer right before COVID or during the pandemic?
I transferred right before COVID. So when I entered the University of Arizona, it was all the implementations of COVID, I guess, guidelines were in place. So nothing was happening in person. Everything was on Zoom. Everything was via instructor live instruction. So it was very difficult to transfer from something where, like, at PIMA and at the community college level, you're in a very intimate setting. You have perhaps like one professor and then like 20 other students in your class. So it is a very close setting, and you're able to interact and really get to the root of your education. And then obviously with the educational system at the university, it's on a much larger scale. I had expected to be entering like large halls full of like 200 students per classroom, just seeking out opportunities where you can do this type of socializing has been really beneficial in my transition. I've joined honoraries such as Alpha Epsilon Delta, which is the pre-health honorary on campus. And by doing so, I've met a great deal of new people. Getting on board for that honorary was a great experience because it really introduced me to a smaller group of individuals who shared similar passions as myself. And I think that was really important, transitioning from such a smaller scale to a large scale institution.
So you're saying that COVID-19, along with the system, the educational system, the biggest thing you saw was the lack of intimacy, and what really helped were different interventions such as joining a club. Well, what was your feeling? Like, why do you think that played such a big role in the students' lives?
Yeah, I mean, even prior to COVID, I think especially with COVID exacerbating this, the need to find a support system where you feel like you are supported, whether it be educationally in your academics or professionally with your career pursuits, or just socially trying to interact with one another with shared experiences. I think just that need to seek out a support system is always ingrained in humans as a whole. We're just very social creatures, and being able to find that, yes, there were obstacles along the way. Being able to find that and like reaching that end goal does make the whole journey a little bit smoother. I guess I would have to say it really does like also allow you to reflect how far you've come. And I think everybody can take a look back at the beginning of the pandemic and just see those periods of isolation where, I mean, most times we ever were doing anything was maybe going for a 15-minute walk outside and waving at our neighbors, all the way to now where we're having full-scale Zoom functions where we're able to converse and meet one another. One of my current labs that I'm participating in, we've had people from the East Coast participate in this program, and it's so interesting to see how diverse and expansive just a Zoom-centric environment can be. And I'm sure if it was prior to COVID and we were doing this, it would have been a lot more difficult to meet people from such a wide, expansive background. And just it did bring a great deal of opportunity with aside from the challenges that it did bring.
Yeah, no, and I think that's really inspirational that even in times when everything seemed the lowest, you found a way to find opportunities and find a way to persevere and be persistent and determined. And I think that's what really shows true value. So then, do you have any other comments of how COVID-19 has affected the youth and the educational system or students' life in general?
Yeah, I think something we really have to consider is how we can move forward with the information that we have now. I don't think it's necessary to completely disregard all the guidelines and just knowledge that we've been implementing throughout this whole time. I think there are a lot of certain aspects that we can really, promote and build and progress further. The discussion surrounding, like I mentioned prior, telemedicine, that's something that really could be taken into consideration and be used in a greater array of communities, such as rural areas, especially within border areas within southern Arizona. I think that's something we should really consider, and just how to figure out the, dynamic issues that come along with that. But I don't think that we should see everything as a downfall or a difficulty that we should just kind of forget or leave in the past. I think we can definitely take a lot from what we learned within this past year and implement it and improve and ensure that this is, doesn't happen again. I think it's important to always review where things went wrong and just make sure that we can go forward and apply preventative measures and just make sure this doesn't really go to the scale that it has been at.
Yeah, no, definitely. And you bring up really good points about how it's affected the rural community. And that's something that we should preface, especially in previous podcasts. The people I've interviewed, they've definitely said that COVID-19 has affected them dramatically, especially the students who were raised there and trying to get, going to college from there. So no, you bring up really good points, which leads me to my next set of questions is, so can you talk a little bit more about your ethnic background, what community you came from, and your thoughts on how COVID-19 has affected your community?
Yeah, of course. So I'm from Thailand. I was born and raised for a little bit in Bangkok, Thailand, in this small village. Before I immigrated to Canada, and then now I'm currently residing in Tucson, Arizona. But within my cultural background, I do heavily identify with being Thai and just being a woman of color in the United States. I think something that has definitely come to light, or that we've seen, is just a little bit of the racial hate that has come up. We've experienced the pitfalls of what this pandemic has, the true colors that it has shown of people, and things such as Stop Asian Hate that has stemmed from that, and how people try to work to promote that. With all the controversy and all the conspiracies that surround the pandemic and COVID-19, I think it's important to remember that we shouldn't be, placing the blame on a certain subgroup of the community. That has made me a little bit nervous, just with everything that we've seen in the media and what has been shown to us, and just the hate that can come from this pandemic. But I feel as if that it's also was kind of necessary for us to see that side of humanity, and to ensure that we don't fall back or regress back into that kind of hatred, and just continue education for how we can prevent those type of racial attacks, or just bouts of anger, and just how to better express those feelings, because that's especially in pre-health or those types of professions, identifying those like types of disparities or those type of biased thoughts is really important to ensure that we don't regress back into these pitfalls.
Yeah, no, you bring a really good point about how, COVID-19, I feel like, has affected Asian Americans in a kind of different way, in the sense that in the past year, the hate against Asian Americans has risen immensely. And you talk about how it's affected you as well. So can you talk a little bit more about that, about your experience with the rise of Asian hate?
The rise of Asian hate, it's such a, it's a very, deep and complex issue, but just from the pandemic alone, it's very troubling to see not only things you see on the media, things shared on for a variety of social platforms, but like within my own family. I remember my mom's currently residing in Texas, and she had an experience where a woman approached her at a shopping mall and just spewed some hate towards her, unprovoked, like it came out of nowhere. And obviously that does bring fear to me, thinking about, things that could happen to my mother, my siblings, myself, even my friends, and how it's so, it's so unpredictable. And it really does make you question a lot, but I would like to believe that it's because they just are unsure. These individuals they're not really sure. They weren't educated on how to express these biased thoughts, because I believe everyone has biased thoughts, but it's what you choose to do with them and what your actions, your actions following those thoughts is a reflective of yourself as an individual and your morals and your moral compass as a whole. But yeah, it is very troubling to see. I can't deny that, but I would assume that, hopefully that facing these things with positive thoughts and just educating people further on these type of racial disparities can help prevent these kind of expressions in the future.
No, definitely. And it's very concerning to hear about your mother's story. I'm so sorry to hear that. So what are your thoughts then on how COVID-19 has affected your community, the Thai community, other than the Asian hate towards them? Like, do you feel like COVID-19 has had other effects to your community?
Yeah, so within Tucson itself, obviously religious gatherings weren't allowed. So I used to go to like this Buddhist temple a little bit out of town, and that had to end. And obviously that's like some people seek comfort in those types of gatherings. So I'm sure that was very difficult, but on a larger scale, I guess internationally, going back to where I grew up in Thailand, it was a very small and rural village. The closest town was like an hour, like major town was like an hour or so away. So it was a fair drive out. And when you're faced in a situation like that with like lack of medical care, or I guess lack of quality care, especially with the population in those types of communities being quite elderly, there's obviously the fear that if an individual gets sick, then what is to happen next, or what is the next step for that community? And I have a great deal of family that still resides in those villages. So to hear back from them and to get the ever so often update that an individual has contracted the disease or has had to go to the nearest city to get treated, it does make you want to reach out or to like take further action. And that's why it inspires me greatly. That's why I think it's important to have these, I guess, focuses on rural communities, because they are the ones that are most at need. We have to consider all these disparities, not even like the broad generalized ones like financials and racial, but like smaller things like transportation. Like, what is an individual to do if they're pushing 70, 80, unable to drive, and they need to seek medical care? Or what is an individual supposed to do if they lack, I guess, the insurance required, or just all these smaller things that we really don't take into consideration for these rural areas. Going back to like things like telemedicine, the issue about, well, someone needs to have technology and someone needs to set up the equipment and someone needs to be there to run it and monitor it and make sure that it's working. And within our own community, like we've all experienced failed calls over Zoom and just technical difficulties. So then to put that in an environment where people are so unsure or I guess unfamiliar with this type of technology, there are all these like minor underlying issues that also need to be considered, rather in addition to the like in parallel to the large scale issues of like disparities within these rural communities.
It's already hard enough to know that your relatives are in trouble if they were a few miles away or even in the next state. But to hear that they're all the way across the world, and you really are just waiting to hear the updates, and sometimes those updates are good, but sometimes those updates are bad. And can you talk a little bit more about like how that experience was? Is like knowing that your family is living in a rural town with limited access and full of health inequities, and just the experience with COVID and family that occurred because of long distance.
Yeah, I think knowing that fear and knowing that you're unable to travel and go, I guess, like hands-on help them really makes you look back and reflect on what you can do within your own community. Like, what if there could be an individual who's experiencing the same thing I'm experiencing? They're in another country and their grandma, their cousin, or their siblings are in rural Tucson and they need help. So I think it's important to consider things as a community, not even a community within your own city or town or state, but I guess worldwide. Because I'm sure that my story is very similar to others that they may be experiencing. So knowing that I couldn't really be there hands-on kind of just made me take a step back and made me think, okay, how can I be hands-on within my own community, for someone else's grandmother, for someone else's family member, for someone else's cousin, all these things. And like there were a great deal of like those types of opportunities where I could, you can like make small care packages, you could help out at the Vax pods. There were those like little hands-on things that you could do. And I guess those types of things, doing them in Tucson, it made me hope, I guess, that someone else was doing those things for my family members. I think it's very narrow-minded to just kind of want to help within your own, I guess, subgrouping or just within who in your nuclear family and like whoever's closest to you. I think we have to consider that everyone is a family to someone, and that it's our job that if they can't, step up and be there for that individual because of the issues that I was experiencing with like inability to travel and distance, that we could at least be here for them since they're unable to make it.
You're probably right. There's probably so many Asian Americans who are going through what you're going through. And what do you think is the role of the youth in trying to change this? Whether it be to counteract this Asian American hate that's been rising, or whether to, fix this bridge or gap between the residents, Asian Americans living in America, and the people living in Asia. What are your thoughts on that?
Yeah, I guess I can approach this in a two-part manner. So to begin, personally, I think what was valuable was just sending what resources I could, whether it just be kind words or I guess financial resources, anything along those lines. And it doesn't have to be anything too major, too crazy. It's just within your own means. And I think by being able to do that virtually or from a distance, being able to send what I could, I think that was really fulfilling and rewarding. But I think in general, for like on a broad scale level, I think preventative measures and intervention measures are completely necessary, and those can only be done through the use of like educational tools. So for example, you discussed Asian hate. So the only way that hate is able to continue is people continue to choose, I guess, like being uneducated on the topic and why and where this hate stems from. And we often saw that with the rise of like certain media sources and just the types of information that was being spread on media platforms, a lot of it was false. And I think it's important that we are not only educating individuals, but giving them the right resources and the right types of education, and just putting that out there. It's very easy to, just post something that you hardly read just so you can be part of the movement. But I think it's also very important to be quite proactive in what you're enforcing. I think the type of resources that you're, I guess, providing for others, you should also be proactively aware of, and like really go deep into the topic that you're passionate about. Like the discussion about Asian hate, it just, people weren't being informed on the, I guess, the background of the virus and just the impact it had globally, not just within the United States.
My experience with public health, I've seen that a major intervention is one, of course, the impact you make, like going in person and actually making a difference. But other intervention is definitely education. And actually, that brings up a good point, is education regarding COVID-19, the COVID-19 vaccine. So can you talk a little bit more about maybe your experience with the COVID-19 and COVID-19 vaccine, whether it be what you've seen with the Asian Americans in the US as well as back in Asia or even Thailand?
Yeah, of course. So, I mean, the discussion of the vaccine obviously brings forward the discussion about the hesitancy surrounding that and just the, I guess, the back and forth on why people want to or don't want to. So I worked at the Vax Pods for TMC and the University of Arizona when they first opened up. So that was around, I guess, late December, early January for TMC, and then a little bit late January for the University of Arizona. And I was able to participate in both those Vax Pod opportunities. And it was really, I think since I was like on the side of being able to see individuals coming in and getting vaccinated, it was really exciting to see how, I guess, people just had a new approach to the pandemic and there was a lot of hope. But I think also surrounding myself within those types of opportunities really blinded me to the other side of the argument of why people choose to not take it and just just how they would argue against that, and which is very tough to see, obviously. I myself am vaccinated and I'm a huge promoter of that, especially since as a worker at the Vax Pods. So it is tough to hear the criticisms regarding the vaccine and the importance of, I guess, just educational resources in regards to this topic, whether it be Asian hate, whether it be the pros and benefits of getting vaccinated, whether it be, I guess, standards for COVID regulations and safety standards and how to follow those. They all stem from just constant education. I could say for sure myself at the beginning of this pandemic, I had no idea what was going on, like without a doubt. I just followed the guidelines, I quarantined, but at the end of the day, I didn't really know the depths of this pandemic until I started looking into it. And I started looking at all these just, I guess, issues that stemmed from the pandemic. I think it's very easy to be blind, or I guess just choose to be ignorant to these facts, because it is easier without a doubt. But I think what is more valuable is to stay on top of it. So then when we have these types of discussions, we're able to actually provide input that isn't biased or just misinformed.
Okay, so then in that case, what did you see as the biggest concerns that Asian Americans or Asians in Asia had against COVID-19 vaccine?
Yeah, I think a tough issue was, I guess, access to start off with, because with everything, with all these various vaccines coming out, we had like AstraZeneca in Europe, and then we had obviously like the three here, Johnson, Moderna, and Pfizer. But I think it's the fact that every country was kind of doing this on its own. So like Asia and like China and like those countries and like India, everyone within those little subgroupings were doing their own thing. And then the US was doing its own thing. And then Europe was doing its own thing. And I think that was a major drawback in the way we approached this pandemic. We kind of did it in like everything for ourselves, like everyone just do it for their own benefit. And that really limited the type of access that you could get to vaccines, especially within Asia. I do have to say though, after doing a couple I guess research on the topic, there were like a lot of things, I guess, that Asia did quite well, because going back to the SARS epidemic back in the 2000s, like they experienced something quite similar to this. So when COVID came, they were able to, I guess, implement resources such as like same day walk-in clinics for testings and just like a number of like testing centers apart. And I think the issue was that the US, instead of making it a public health issue, we made it like a political issue because this was also happening during a political year. So I guess a lot of campaigns were on the basis of how can we use this pandemic to our benefit rather than how can we benefit the people. And so like, while yes, there were complications within countries such as Asia or like, I mean, continents such as Asia, there were like also like, we were able to see them come out on top and see how they handled it. So while there were like a lot of drawbacks, we were able to see how they were able to handle it. And I think in essence, coming together on, I guess, universally, rather than limiting it to like the right of each country, that could have made things more efficient and effective in allowing the pandemic to come to an end.
Wow, no, that's really great to hear, and definitely reasons to have concerns. And no, I really enjoyed hearing your perspective about how COVID-19 has affected your community and in the nation and internationally. So thank you so much, Nadia Clark, for joining us on the You in Youth and sharing your perspective on how COVID-19 affected you and the people you've worked with as a pre-health student. It was really interesting to hear about COVID-19's major impact on you and your community in the US, as well as in Thailand. I really appreciate your perspective on its effects on the patients and students you've worked with and experiences you've had with COVID-19 and the vaccine. I hope to talk to you soon and hope you have a great rest of your day. Thank you.
Thank you.
Thank you all for tuning in to the You in Youth. Stay tuned for the next episode as we continue to dive deeper into the different effects the pandemic has had on the youth and the communities. As always, I would love to have more people join me on my podcast and share their perspective and stories regarding their experiences of COVID-19. If you're interested in being part of this podcast, please email me at sdaulat@email.arizona.edu. That's spelled SDAULAT@email.arizona.edu. Thank you and have a wonderful day.